How do I navigate osteosarcoma? Medical terminology. Understanding osteosarcoma medical terminology can feel overwhelming at first, but breaking down key terms makes it much easier. Osteosarcoma is a type of cancer that starts in the bone, specifically in cells that normally produce bone tissue. It is also called osteogenic sarcoma because it originates from bone-forming cells. This cancer most often occurs in long bones like those in the arms or legs, especially in teenagers and young adults. The word sarcoma refers to cancers that develop from connective tissues, including bone, cartilage, and muscle. Since osteosarcoma arises from bone tissue, it is classified as a sarcoma. When doctors describe the tumor, they often mention the production of osteoid, which is immature, unmineralized bone matrix made by the cancer cells. This osteoid is weaker than normal bone and is a hallmark of osteosarcoma under the microscope. The term primary tumor indicates the original site where the cancer started, which in this case is the bone. If the cancer spreads to other parts of the body, it is called metastatic osteosarcoma, with the lungs being the most common site of spread. When the cancer is confined to the bone or nearby tissues, it is called localized disease. A biopsy is a crucial step in diagnosis. It involves removing a small tissue sample from the tumor to examine under a microscope. For osteosarcoma, doctors prefer an open or large-core biopsy to ensure they get enough tissue for an accurate diagnosis and to plan treatment properly. Histologic classification involves studying the tumor cell's appearance to determine the subtype and how aggressive the cancer is. Treatment planning often involves understanding whether the tumor is high-grade, meaning it is more aggressive and needs intensive therapy. Symptoms of osteosarcoma usually include bone pain, which can be worse at night, swelling around the affected area, and sometimes fractures due to weakened bone structure. When navigating medical reports or discussions, it helps to recognize these terms and what they mean. Asking healthcare providers to explain unfamiliar words can improve understanding. Patients and caregivers should request written materials or trusted sources to learn more. Diagnosis relies on biopsy and imaging tests to determine the tumor's type, size, and whether it has spread. Treatment typically involves surgery to remove the tumor, often aiming to save the limb, combined with chemotherapy to target cancer cells. Radiation therapy may also be used in some cases. Remember, each case is unique, and treatment plans vary based on whether the cancer is localized, has spread, or has recurred. Becoming familiar with these terms empowers patients and families to communicate effectively with their medical team and make informed decisions. Always consult healthcare professionals for personalized advice, as medical experiences can differ widely. Understanding these key terms helps demystify the process and supports a more active role in managing osteosarcoma.